This is Jerry Hesch, a physical therapist at Hesch Institute in Aurora, Colorado. And my client is a 39-year-old male, very active, very strong body type. And he has a history of significant stiffness, and his back will go into spasm where it's very difficult for him to put his shoes on. No specific precipitating event. In fact, he doesn't know why this back pain commenced a couple years ago. He's aware of stiffness in his low back and stiffness in his legs, in his hips, and I thought I would have him demonstrate to us his routine of stretching his hip flexors. Can you show us?
Sure. So I'll show you the first one.
Okay.
I roll off my bed and I get to the floor.
Uh-huh.
Do a little of this.
Uh-huh.
Sometimes I'll do it with my hands elevated, like on the bed or something like that.
Uh-huh.
And then I'll go down to sort of like a modified sprinter lunge.
Okay. So one leg's in front of the other, one's in back?
Yeah, and I just
Good.
go forward.
Okay. And how often do you do that stretch? How often do you go forward?
I'll do it like 5 or 10 times on either side, so you know, I try not to do static stretches in the morning, and just more movement stretches. So
okay, very good.
Bounce up and down.
Uh-huh.
And switch legs.
And this is a daily routine?
Every morning.
Yes.
Before I do anything, straight from the bed.
Uh-huh.
And then I'll do, I don't know what they're called, but you know, kind of side bend stretches.
Uh-huh.
This.
Yeah.
And then I'll do them like on the, you know, kind of using the sink to brace myself, or, you know, kind of will grab the sink, just a little bit more aggressive like this. And then sometimes it might be easier to show it like this. I'll get to the floor and do like baby pose.
Uh-huh. So your knees are outward?
Yeah, and roll. And
okay.
then I'll do, you know, a couple of these per side. And then that's kind of my routine.
Yeah, yeah. And you have to do this every day?
Yeah, yeah. When my back spasms, it's always in the morning, and I don't, it's always happened before I do that stretch, those series of stretches. And one time it happened while sleeping. So
yes.
Yeah, usually if I'll get up in the morning and I don't go through that sequence, you know, it's happened when I've put on clothes, when I was picking up something off the floor, when I was putting away the dish. So basically anything first thing right in the morning while I'm leaning over.
Yes.
And one time while I was sleeping, which I can't explain. But
very good. Well, lay on your stomach, please. I'm very surprised at the tightness in your hip. You could call it hip flexor tightness.
Mm-hmm.
Limited hip extension. I'm only getting 10 degrees on the left. And with that daily stretching, somehow it's not targeting it. And this one is a little bit less. I use a very simple technique that is passive. It's almost counterintuitive. You wonder, how could this, you know, release tight hip flexors? And what it does, go ahead and line your back. What it does is it gaps the hip joint. And so it puts tension on the capsule of the hip joint and on the ligaments. And I take a piece of 3-inch tall foam and I place it right under the sit bone. And I do that on both sides. And I do that for 2 minutes. So it's totally passive. So I'm going to set a timer for 2 minutes, and then we're going to come back and film the response to this.